Oh, recording it now, my intro. I'm here to introduce Dr. Mike, someone who's been around for a long time and does not need too much of an introduction to most. Although I've not been to visit him yet for his services, I've heard many good things about him and what he does for others. He answered a few questions for me. One was what superpower he would like to possess, and he'd like super energy. His reason being he would like to have more energy, spend as much time living his life, learning, loving, and healing. For his favorite destination, he chose Disney World. He said he always is amazed at the level of fun, inspiration, creativity, customer service, and beauty they're able to deliver. And that's probably centered around his two daughters and taking them to Disney World. Today, he mentioned two topics he may cover. I think he's going to cover the other one now, but I was hoping he was going to cover the subtle power of wellness he mentioned to me. But go ahead and take it away, Dr. Mike.
Thank you, Victor. We'll be covering the subtle power of wellness soon. I figured with the new members, we wanted to talk a little bit about neurological chiropractic. What is neurological chiropractic? How is it different? Most people, when they think of chiropractic, is what, everybody? Cracks, twists, and pops, right? There's lots of videos, there's lots of folks that you talk about, and the whole, some people love the cracks, some people hate the cracks, whatever it happens to be. In my practice, about 1% of my adjustments are the crack pop type. So almost all of them use neurological tools in order to get this spine, the nervous system to react the way we want it to react. So the brain and the spinal cord and the nerves and the organs are all based on circuits. So you have the brain that runs down the cord, out to the heart, from the heart to the cord, back to the brain. That circuit has to be as clean as possible for that organ or for that muscle to function appropriately. So when somebody comes in with vertigo, and I can see that they immediately have balance issues, they go from a sitting to standing position or lying down to standing position, I know it's a very, very, very high level of neurological complication right here in the very base of the neck, the brain stem area. Excuse me. Differently, if they have peripheral neuropathy, like which is where the arms or legs, we've been talking about neuropathy lately, have dysfunction of the nerve. So the nerve is getting damaged, the nerve is dying off. Much more complicated because now it can be anywhere from the brain to the neck, to the mid-back, to the lower back, to the hip, to the knee, to the foot, to the toes. So that whole nerve pathway in both directions has to be addressed. So as a neurological chiropractor, we have lots of therapies and techniques to find out where exactly, and that therapy is called nerve tracing. When we do nerve tracing, we do tests all along the way to find out which nerve is most affected. Some of the nerve tracing techniques we use is when we have the body move in different positions. We may have them move the arm in a different position. We may have them move their leg in a different position. We'll check their posture. We'll check their balance. We'll have them turn their head different ways so I can see neurologically how their body responds. And, you know, many times the patient won't even feel the difference that I see. But if I see them turn their head 90 degrees one way, and then when they turn to the other side, it tilts and goes down, I know neurologically there's some type of dysfunction in the lower part of the neck. And I can find out if that's related to their condition or it's just another condition underlying. So those first few visits, I gather all my information and I figure out which area of the spine, which area of the feet, which area of the hands, which area of the nervous system is most effective. Now, I mentioned one of the therapies is called cranial therapy. This is crucial for concussions. When people get hit in the head, you need to address the head. Okay, I know that seems a little obvious, but in all of neurology, the highest levels of neurology, they do an MRI, they look, make sure nothing's, they evaluate the damage to the actual brain itself, but they don't look at the cranial structures. When you get hit in the head and some of the cranial bones dent in, now you have the flow of the fluid over the brain starts to become turbulent, just like a rock in the river of a river, how the turbulent goes over there. So that will lower the healing process of the brain. So when we're working with a concussion patient, we have to check the actual cranial bones. We have to check the upper neck bones, the lower neck bones, because when they get a cranial injury, their neck goes with it. So it's a whole neurological assessment. In medicine, their main treatment for concussion is rest, leave it alone. I mean, that's the lowest level of treatment that there possibly can be, but that's the standard of care, is to leave it alone. We use laser therapy. Lasers are all set at different frequencies. I'm sure you've seen lasers with surgeries and things like that. Those are very high frequency lasers that burn and cut tissue. Ours are much lower level frequencies, but each frequency is set to how the cell is supposed to vibrate. So if somebody has inflammation and pain in their knee, say, I can use one of my magic lasers, and some of them have red lights, some of them have green lights, all different colors and such. You could probably see it on my face. But we can use those to bring down inflammation. It actually vibrates the cells at that same frequency to lower the pain levels and bring the inflammation down to the tissue. It's a crucial part of healthcare, and it's taught right in the neurological program. One of the other things that we do is called nerve flossing, where we identify where the nerve is itself. In chiropractic school, I was disappointed when they never touched the muscles. They always did spine, spine, spine. And I said, well, how about if the nerve is pinched in the muscle itself? And they said, leave that to the massage therapist. Well, the massage therapists know almost nothing about the nervous system. That's not their category. It's just muscles. So if you have scar tissue in the nerve, in the muscle itself, where the nerve is, we need to actually grab that nerve, then have them move through ranges of motion and floss that nerve back through that scar tissue so the nerve can heal and work as it's supposed to be in that same circuit from the brain, down the cord, out to that area, and back again. It can happen in either direction. Oftentimes, after patients get a neurological adjustment, they say, oh, my brain feels clear, and I might have just adjusted their tailbone or their feet. It's because the circuits go from the top all the way down to the bottom and all the way back up. So as their pathways get more clear, their body responds, and sometimes a little lightheaded, sometimes a euphoric feeling, that kind of thing. But that's all very normal. One of the therapies that we do is called decompression therapy. So decompression therapy is an advanced traction therapy. Maybe you saw back in the day where they would pull somebody's neck and hold them in traction or lay them in a hospital bed and put them in traction. That's just one pull. What a decompression does is it pulls gently, holds, and then pulls less, and pulls more and pulls less, and it pumps the disc. Now the disc is crucial because it's loaded with nerves. So if somebody has pain that radiates running down their arms, running down their legs, or if it gets worse when they stand, then we know pretty much that it's disc compression. The only way to open that disc is to decompress the disc. So it's a crucial part of a neurological chiropractor's program. So this just gives you a little bit of information. Complicated conditions, I see easy things like neck pain, radiating back pain, sciatica, and all those kinds of things that you hear about. But I also see very complicated conditions like multiple sclerosis and Parkinson's, and even organic conditions like high cholesterol and diabetes. So over the next few weeks, we'll go a little more in depth. Thank you, everybody. Neurological chiropractic.
Thank you, Dr. Mike. I was surprised to learn that nerve flossing